Miss Cindy, Miss Christy, and we are from Robison Orthodontics, which is just down the street from you. And we're here to teach you about taking really good care of your teeth. You want those teeth to be beautiful and have beautiful smiles for the rest of your life. All right, we are inviting you to band together with us. And these bands that we have on indicate that we have promised or pledged we're going to take good care of our teeth, and there's several things that we have to do, and we're going to explain them to you. We want you at the end to be willing to join with us and pledge to take care of your teeth. Our teeth help us do many things. These front teeth are incisors, and they help you bite into things. They help you chew. Back molars, they help you to whistle, and they help you talk. There are certain sounds you can't say if you didn't have your teeth. Try this. Put your lips over your mouth. You're going to try the S sound. Miss Cindy, sing songs. You sound silly. Okay? You need those teeth. All right. And they really help you to smile pretty.
Do you know something interesting about smiling? Children smile over 400 times a day. That's a lot, isn't it? Yeah, adults, they only smile 15 times a day.
Okay, I do need your help on this one. I want to know how many baby teeth or primary teeth do we have? So if you think you know, these are the answers. It's either 8, 16, or 20.
All right, I'm going to call on somebody, and I need somebody that's real quiet. Good. You in the purple plaid right there. Do you know how many teeth we end up with? 20. 20 baby teeth is what we end up with. You're very smart. Got a little something here for you. I'm going to toss it over your way.
Good answer. 20 baby teeth. And some get a little bit different, but it's normally that. Now, many of you have already lost teeth, so I do need your help on this. What age do you start to lose your teeth?
What age? Is it 2, 4, or 6? Okay, you in the back row, gray shirt. You? 6, yeah. On average, at 6 years old, we start to lose those teeth.
These are smart 4th graders here. 6 years old, it can be different, but that's when most kids start losing their teeth. All right, and then, I don't need your help on this one, but I want you to think, why do our baby teeth fall out? And it's because as we grow, our face gets bigger. Imagine if I had little tiny baby teeth and I wanted to eat my steak or corn, I would look silly and I would have a hard time eating. So we need bigger, stronger teeth as we grow older. When you lose your tooth, I wonder if you've ever tried to do something like this boy. Turn that down.
Okay, you ready?
Okay.
Go.
Isn't that awesome? Watch. Oh, that was a very clever way. Now, you don't need to try that. You can just pull it out with your fingers if you want. But we thought that was pretty cool. After we lose our baby teeth, we get our big or permanent teeth. So I do need your help. How many permanent teeth do we have? Miss Christy's going to call on you.
Okay, yeah, I'm going to choose somebody over here. You in the red shirt on the end.
24.
It is. 24 is a really good guess. I'm sorry. You in the green right here? Yeah.
32.
32. You got it. Good job.
We have 32 permanent teeth. Miss Christy.
That reminds me, snails have 25,000 teeth. Those little teeny things, 25,000.
Wow, we don't have near that many. All right. We're all different. We have different kinds of teeth. What if we had horse teeth? Crocodile teeth? What if we had dog teeth or cat teeth? You know, Animals have different teeth depending on what they eat. And I want you to know, roosters do not have teeth, okay?
Alligators, though, alligators are pretty neat. They actually have a bird, it's called the crocodile bird, that flies into its mouth and pecks at its teeth to clean its teeth for it. And it doesn't eat them. Isn't that cool? It's really
Lucky
cool.
bird. I don't think I'd go inside that mouth to
No.
clean them. What if animals had people teeth? I'll tell you what, the sharks wouldn't be able to eat what they normally eat. No. And again, this silly rooster, they don't have teeth. Okay. But everyone's teeth are different. Look at this next one. Everyone could have little, big, yellowish, kind of white. But teeth make our smiles look beautiful. Now that baby right there has a binky. That's not her real teeth. Yes. Good thing, huh? I do need your help. How long should our permanent teeth last us?
Okay, let's see. You in the orange shirt right in the middle.
Nice and loud. What's your answer?
Okay, that's a really good guess. And yes, past 40. So you in the green?
About 50.
Past 50. Okay, one more and then we're going to give it to you. You in the red shirt right here.
Yes.
Yep. Forever.
Forever.
Good job.
Our teeth are supposed to last, because how many sets do we get?
Two.
We get our baby teeth and our permanent teeth. That's it. So we want them to last a long time. Here's some who forgot to take care of their teeth. Do you want to smile like that? No.
Take good care of the
Absolutely
teeth.
not. So you're going to listen. Yes. Whoa. What happens if you do lose a permanent tooth? I know we don't need your answers on this one. You know you don't get another one.
No.
You get that one shot. Miss Christie.
That reminds me, sharks though. Sharks have over 30 sets of teeth in their lifetime, over 3,000 at one time, and can grow a whole new set of teeth in just a week.
Wow.
Yeah. They
If
get
I
a lot of
lost mine,
teeth.
imagine if I got 30 chances to knock them out. This guy only got that one with his permanent teeth, so he doesn't get a new one. He has to have something else put in there. Now, teeth give structure to our face, and if we lose our teeth and have to get false teeth, this is what happens. That lady's face pretty much just caves in, and it doesn't look right. When she puts her dentures in, she'll look a little more normal. Okay? If you don't take care of your teeth, you can get cavities. And when you start to get cavities, they don't show up like these big ones here. They're not big enough for you to see, and they're not big enough for your dentist to see. He has to take x-rays to see them when they're really tiny. But if you let them get that big, by then it'll start hurting, and it's really hard to save that tooth. You want to keep those teeth. So pay attention to what you have to do to keep them really strong. They normally don't hurt you when they start out, so you won't even know you have one. That's why the dentist has to check it out. I do need your help on this one. What causes cavities? And I'm going to tell you the answer is not sugar bugs. I need something a little more scientific there. What is it that forms on your teeth, Miss Christie?
It's a clear, sticky substance. You can see it real well in this picture. Okay, you in the gray right here. Plaque. You're brilliant.
Great
Thank
answer.
you.
Plaque. Ms. Christie, tell us something about plaque. What happens if you don't get it off?
Plaque is real easy to brush off, guys, and that's why this stuff builds up on our teeth as soon as we're done brushing our teeth and we have something to eat. So it's very important that you brush it off every day. If you don't brush it off or go to bed without brushing your teeth, what happens is tartar starts to form. Tartar is the hard substance we can't brush off, and that's what the dentist needs to scrape off our teeth. So.
Don't try and scrape tartar off, because you'll scrape your enamel. So the dentist or the hygienist has to do it. Okay, you answered it right. Good job. So that was plaque, a clear, sticky film. Remember that. And it turns to tartar. We want you to avoid plaques. So here are some things you do and things you don't do. First, Things that you do. Of course, you brush your teeth. You use mouthwash because that gets rid of more germs. You floss, and you floss in between the teeth because your toothbrushes do not get in between the teeth. And guess where most of the cavities start?
In between the teeth.
In between.
Right, in between the teeth. Okay, so if you're not flossing, you might have a problem when you go to the dentist. Eat good foods for you, and then drink water, and go to your dentist twice a year. All right? Things that you don't do. Soda pop or lots of juices. Not good. Miss
That
Christie.
reminds me, did you know soda pop and juices, people who have over 3 or more a day have 60% more cavities than others. So that's a lot more.
That's why I drink
Sticking with
water. I
water.
don't want to go get a cavity filled. Okay, and if you eat just soft foods, it's not strengthening your gums. It's not good for you. Just have soft. You have apples and carrots. That's good for you and your teeth, okay? And if you go to bed without brushing, that's a great time for plaque. Plaque loves it when you go to bed and don't brush because it goes to town, working away, making that clear, sticky film. Thumbs up or thumbs down? Is this stuff good for you or is it bad for you?
Good job.
Okay, you guys are smart. The next one, is this stuff good for you or bad for you?
Yeah.
Oh, thumbs up. There we go. Now, when you go home after school, surprise your mom. Say, Mom, I don't want that ding dong. I don't want that Twinkie. I want some fruits and vegetables. Then pick her up off the floor when she's so shocked. We want to talk about how to brush your teeth, but before we get there, we have to talk about the things you use. So first off, when you brush your teeth, you have to have a good toothbrush. And there are lots of toothbrushes you can find in the store. Some of you might have these electric ones or the ones that rotate or move around. Some of you might have those water picks too. Fancy ones, colored ones. What matters on a toothbrush are the bristles. You do want the handle the right size, but look at that and that compared to this one. There's 3 things you need to remember about your bristles. Miss Christie, tell me something about bristles.
Well, you know, they need to be soft, okay? Well, bristles, you know what? That reminds me. The original toothbrush was made with cow hair or hair from hogs. Ew, those things roll around in dirt, right?
Aren't you
We're so
glad they don't
lucky.
do that anymore?
But you know, bristles should also be soft.
Yes.
Yes. It used to be that we used a lot harder bristles. These soft bristles are healthy for our teeth and don't scratch them. So make sure that your tooth bristles are soft.
Soft, that's one thing. Second thing, again, we don't want these. We want them to be very, very straight. Okay, soft, straight, and clean.
Yes.
Miss Christie, how often do we change our toothbrushes?
You know, you should be changing your toothbrushes every 3 months, or anytime you guys get sick with a cold or flu, it's important that you switch out that toothbrush because the tooth bristles will hold all those germs in there and you'll get sick again.
Good. Are you learning anything or did you all know this?
No, some of it?
Oh,
Good.
well, we're going to, most of it, well, we're going to have to get harder
Good.
then. Okay, let's see. Next, that's a review. The 3 things that has to be straight and soft and clean, the bristles. Okay, then toothpaste. You guys can use all different kinds, but it's important the toothpaste that you do use, make sure it has what's called fluoride right there. That stuff protects your teeth. Okay, some people like to use a lot. That right there is all you need. Just this little size of a pea, little bit of toothpaste. Now, when I was growing up, we used to use some baking soda. It doesn't taste very good at all, but if you run out, then I would get my wet toothbrush, put it in there. It's like salt. It kind of tastes like salt, but it wasn't bad for your teeth. It's just not that great. I'd rather use toothbrush any day. And did you know, after you brush your teeth, you're not supposed to swallow that toothpaste? You knew that, but did you know you really don't have to rinse afterwards? They prefer you spit out, but leave some of that toothpaste in because that fluoride will protect.
Yes, very important. All right, Miss Cindy, I think we have somebody here to help us with our brushing instructions.
We do?
We sure do. I would
Awesome.
love to bring out our friend.
Good.
You know, if we clap real softly, he'll come out here. So
All right.
let's give him
Here's our
a
friend.
quiet
Oh!
round of applause.
Oh my goodness. It's Mr.
He's
Tiki.
here. Mr. Tiki. Mr. Tiki's from our office, and
seen
he
him before?
loves to come help us, show us with this instruction. Hey, Mr.
Oh, hi, Mr. Tiki. So
All
nice of you to
right.
come help us. Look at his beautiful smile. He's going to show us, and Miss Christy is going to show us how to brush your teeth.
Okay, guys. You guys mostly know how to brush your teeth, but I want to show you, kind of the breakdown of everything that you should be paying attention to when you are brushing your teeth. Okay, so now that you have your right size toothbrush, Mr. Tiki has a little bit larger toothbrush than normal, and a little bit of toothpaste on there. You want to make sure that you're pointing your toothbrush at a 45-degree angle toward the gums, okay? So just slightly tilted towards the gums. You're going to make small circular motions. It's important that you pay attention to every tooth. Too often do I see kids just kind of going like this, and they're not really paying attention to every tooth. So pay attention to every tooth on the top. Get those molars back there on the sides. And as soon as you're done with the top, you can go down to the bottom. Again, point that toothbrush down towards those gums. Small circular motions all the way across.
Does that feel good, Mr. Tiki?
Yeah.
Good.
All right. Now we need to get our molars, right? Okay, so our molars, we would open up and make sure that we're making small little strokes on the molars because a lot of food will kind of get trapped in those molar grooves. So we're making little strokes on the molars, both sides up, and the bottom ones. Got those, okay, and then we need to get the back sides of our teeth. So we would make small up and down strokes on the back sides of our teeth, on the top, and then the bottom, and then do you think we're done then? Yet? No. We've got our tongue in our mouth. That tongue has a lot of germs and bacteria on it. So I would have Mr. Tiki roll out his tongue, brush that really good, and then spit out his toothpaste, and he's done.
Good job, Mr. Tiki and Miss Christy. Now, you know how to do it right. This is how long you need to brush for at least 2 minutes. You may have heard your dentist tell you to do 3 minutes. We're asking that you at least do 2 minutes. And that's a lot longer than most of you brush. Do you know how long most of you brush?
5 seconds.
Check
5
this out.
seconds.
Yeah, 5 seconds. That's about right. Mr. Tiki, brush away. This is about how long you brush. Oh, yeah. And he's done. He comes in, Mom, I'm done. He said, what? You're already done? That was only 15 seconds. How long, Miss Christy, do you have to do that?
We'd have to do that a whole 8 times, okay? So let's probably pick a song that is a full 2 minutes or longer and brush your teeth at least that long. Your dentist also gives you those nice little timers. Those are really useful also.
Yeah, sing a song in your head. I like to do exercises, while I'm brushing my teeth. And sometimes I sit down in front of the TV with my toothbrush, no toothpaste, but I'm just working it because I'm sitting there in front of the TV. Might as well. You can do that, especially if you have braces. Hard to get all that stuff out of there. All right, that's a review. Your teeth, your gums, your tongue. And if you don't brush the gums, they get hard, so you have to be able to, yeah, and puffy, you're right. Oh, this is the next thing. Floss is our friend. Remember I said where most cavities start? If you're brushing your teeth for 2 and 3 minutes, you still missed in between the teeth. So once a day, you should be flossing. And there's different kinds of floss to use. They make it really easy. This is new stuff. I didn't have this when I was a kid. All those different picks, that makes it really easy. But it is still better to use that stuff right there because you push it down and then you kind of pull sideways so you're getting underneath everywhere.
For braces, because I have braces, they have this, it doesn't hurt you, but it's a
It threads it, yeah.
Yeah, and you have to...
And those are special, and they teach you how to do that because it's hard to floss with braces. And we'll take more comments and questions at the very end, okay? Okay, and then remember we talked about mouthwash will kill more germs in your mouth so that you're not having problems. Miss Christy.
Did you know if you're out of mouthwash, maybe eat an apple. Apples actually freshen your breath.
And you'll have more friends.
Yes.
If you have good smell and breath.
Of
right?
course.
Okay, great. How many play sports? Raise your hands if you play sports. Well, that's almost everybody. Okay, now, raise your hands if you a mouth guard. Oh, not quite as many. You should wear a mouth guard, especially if you're playing something, well, of course, hockey, but if you're playing baseball or something where you're going to get hit in the mouth, basketball. I had boys that got elbowed in the mouth, and you can knock a tooth out. So if you wear the mouth guard, it's going to protect your teeth. Those are very cheap. You can get them at the drugstore. Okay? Good job. Okay, and if you grind your teeth at night, that will wear them down, so wear them at night. Okay, bad habits. Hopefully you guys are old enough you don't suck your thumbs or a finger, but you know you might have brothers or sisters who do, and that will cause the teeth to jet out, especially if you have your permanent teeth in. When it's little tiny babies, it's not a big deal, but by the time they're getting their permanent teeth, see how they jet out like that? Now if that person were to fall and hit them, they could break off easily. Also, this person will have a hard time biting into sandwiches and things. So stop the thumb sucking and help a younger brother or sister also to do that. This is someone who sucked thumb for a long time, thumb or finger. But see how the back teeth now are touching? The front teeth don't close. So again, can't bite into an apple, can't bite things off. Those incisors are no good to this girl. And so after braces, the teeth look great, but you don't want braces if you don't have to. Okay, that's the one bad habit. Next one's putting stuff in your mouth. Pencils, don't chew them. Paper clips, anything. Don't put stuff in your mouth because it'll move your teeth and it could break them off too. Smoking, we know you don't have a problem with this right now, but so you know, smoking's real bad for your body, but for your teeth, it will stain them, turn them brown and ugly. Miss Christie.
Did you know beavers have pretty stained teeth, but it's not from smoking. Do you know what it's from? Chewing wood, right? Yeah, they have orange teeth.
Orange.
Yeah.
Kind of Halloween-y, huh? Okay, besides smoking, ice cube chewing. Who loves to chew on ice cubes? A lot of people do.
Love it.
There's a problem with that.
Yes.
Let me tell you, if you're chewing on ice cubes, it can break your tooth off. Many of you go to the dentist and they'll paint sealants on it to protect them. That causes those to chip off. So you're paying for a step that won't stay on when you chew ice. So Miss Christie has a great idea. She goes to Sonic and gets the soft ice, the little balls of ice. They're soft and it won't break a tooth, okay? Toothpicks like a pencil. Don't put them in your mouth. Mainly adults do that. And if they're using it to get their teeth clean, that's fine, but then throw it away and don't stick it in the mouth to chew on it because it will move the teeth. And lemons. We're going to talk more about lemons and acidic foods in just a minute, but they're a really bad habit to suck on it. My sister lost all of her enamel from that. Nail biting. Hopefully you don't have this habit, but there's a lot of germs on your fingers. When you bite on your nails, that goes into your mouth, can make you sick. And then by putting the pressure on, right there, it chips off the ends of your teeth. And it'll also make them crooked because it's pushing them, okay? Bad habits, we're all done with them now. You already know the answer for this. Who do you go to for your checkups? Your dentist. Go to the dentist twice a year. Now, there's a dentist. Did you know there are lots of doctors who actually work on your teeth? Most of you have only gone to a dentist. But look, the dentist, there's an orthodontist who puts braces on. Mr. Tiki got braces.
Yeah.
There's a periodontist for if you have problems, diseased gums, if they're really bad, he'll work on them. Endodontist, and I like to think of the end of your tooth is the root, so an endodontist works on the roots. And an oral surgeon, well, they're just cool. I've got to show you a picture of what they do in just a minute. But they do surgery and cut your mouth. And I'll call on you afterwards, okay, when we're all done. Your dentist does these things. He can clean your teeth. He can pull teeth. If some of those baby teeth aren't coming out, he needs to get them out. Check for and fix your cavities. Take the x-rays so he can find cavities he can't see. Put sealants on the teeth. And also, if you got a tooth knocked out, he can put a fake tooth in there. So that's great for the dentist. Then, the orthodontist, he doesn't really put them on goats, but he can put braces on Mr. Tiki or on kids, teenagers, and adults. But he helps them to straighten their teeth, but also you can have straight teeth and they don't bite right, so he tries to fix your bite. Because what if they were really straight, but they kind of went to the side bites, overbite or an underbite. So he will fix that. Helps you smile pretty and feel really good about yourself. Did you know this guy had clear braces? And they're called Invisalign. You guys say that? Invisalign. Invisalign, kind of like invisible. Did you know I have braces on? I have Invisalign just like this famous guy. But I don't get paid as much as this guy here. I have Invisalign. This oral surgeon, remember a cool picture? This is an x-ray of the teeth. But one tooth, instead of coming down like it's supposed to, went way up inside. They would only know that, maybe he felt it, but with the x-ray, so an oral surgeon, not a dentist or an orthodontist, it'd have to be an oral surgeon who could put him to sleep and take that tooth out. That's kind of cool. Battery acid, you know that almost every car that runs has a battery with acid in it. And if you were to open up that spot where the acid is, if you dropped it on the carpet, it'd burn a hole in the carpet. If you dropped it on your skin, it'd burn a hole in your skin. So you surely wouldn't want to eat the acid. You know better. But you know there's things you put in your mouth that you eat that have acid in them, and they're really, really bad for your teeth. They're probably really bad for your stomach too. Watch this. See the outside of that? That's the pretty white stuff on your teeth. Miss Christie.
Cindy, did you know that pretty white stuff is the hardest substance in your body?
Hardest, more than bones.
Oh, more than bones, yes. And the second hardest is directly under that, the dentine.
Okay, the white stuff is enamel. That's the pretty stuff. And underneath it, the brown stuff is dentin. You guys want to remember that, dentin?
Dentin.
Dentin, okay. So look at that baby right there. They probably had a sippy cup or a bottle that they always had in their mouth. So even apple juice, if it sits there and that juice is always against those teeth, it will rot the enamel off, and then that's what's showing, it's the dentin. And I don't think any of you want to smile and have those kind of teeth, so we need you to avoid acidic foods. 5 foods here. Some are very acidic and some are not, so I'm going to show you the one that is the best for you first. Some of you are guessing and some of you are just smart.
Yeah.
Yes, milk.
Good.
If the closer this number is here to 7, the milder it is, okay? It's called alkaline. So milk, yes, super good. Next one, what do you think? Apple. 3.3, so it's getting lower. The closer you get to 1, it's pretty bad. 3.3 for apples. Next one? Ooh, sweet tarts. 3.0.
I didn't even know that.
Next one? Lemons. 2.0. So again, lemons, limes, grapefruits, that kind of stuff. If it's acids against your teeth, it actually makes your enamel very soft.
Right.
So if you have something that's acidic, you don't want to go brush your teeth right away because your enamel's soft and it'll scratch. You want to go rinse your mouth with water, wait 30 minutes, and then brush your teeth. Did you know that? Yes, something you didn't know. Okay, touch of that. Lemons, remember what you have to do if you eat them. The worst for you? Sour candy. This Warheads, how many love sour candy? I love it.
I don't like it.
I didn't know.
Terrible.
I didn't know, but look at this. This number is 1.6. Just guess what battery acid is.
1.0.
Very acidic. So now you know. We would love it if you didn't eat candy, but I kind of know you're going to. So remember to go rinse your mouth out and then brush when the right times. Okay. We're all banding together. Remember this band? Okay. Everyone in our office is agreeing to do this, and this is what you're going to have in your bag. This paper. And you put your name in there, and then you agree you're going to brush your teeth twice a day, you're going to floss, you're going to use mouthwash, you're going to stop eating all that junk food, eat better foods, and go to the dentist. If you do that, you wear the wristband and then do the rest of what it says under the bottom. Everyone in our office, there are different ones that you have, and you can bring them back to their office. Last year, we do a candy buyback, and there are other dentists and orthodontists that do that. We bought 2,000 pounds. Miss Christie, how much is 2,000 pounds?
A whole ton.
1 ton. We
lot.
bought that much candy from kids from the schools in Mesa and in Gilbert. and we sent it off to the military people, and I hope they know how to brush their teeth right afterwards. But we didn't want all you kids to have all that candy. So Dr. Robison will pay you 2 gold dollar coins for every pound of candy you bring in. And yeah, that means you're not going to eat all that candy, but oh darn, you'll have better teeth and you'll be better off. And he will give you $2 for every pound, and then he will also give the school some of the money. So he will match it. And there's a school who that gets the most, gets a $1,000 bonus, and the school gets to buy something for their school. So hopefully we'll be seeing you, some of you in our office, giving up your candy. This is Dr. Robison. He puts braces on normally, but a lot of our dentists in the community do service. And he went to the zoo and worked on a tiger that had a cavity. Also worked on a polar bear, and that's pretty cool, but that animal did have to go to sleep so that he could do the work and not get chewed up or bitten there. All right. Oh, Mr. Tiki loves this picture. He does a lot of races, so if you're ever at races, look for him. He's pretty fast. Try to catch up to him and tell him, hey, Mr. Tiki, you were at my school, and I want you to know I'm taking real good care of my teeth. I'm brushing, I'm flossing, and he'll give you a high five. So Mr. Tiki, good job on that race. Did you know that some of these kids here go to this school? I found that out yesterday. Huh, cool, huh?
Oh, yeah.
I didn't know that.
Yeah, right to the right on the second picture, I think I know.
Oh, good. Teachers, you may want to know that your nurse has access to our Smile Back applications. So if there are students in the school who cannot afford dental work and braces, they can apply for a scholarship. Robison Orthodontics gives out 4 each year, 2 in Mesa and 2 in Gilbert. And so it's something that you might remember. You can actually do the part of the application for them. We loved coming, but I want to know if you were really listening. You listening? Miss Christie, the smart one, is going to check and see how well you were listening and what you remember.
Okay, let's see. What is the second hardest substance in our bodies? Has to do with the tooth. Okay, you in the white. Dentin, yes, very good. Thank you, Miss
Who
Cindy.
said that?
The girl with the butterfly.
Good job.
Okay, and what is the hardest substance in our body? Okay, you in the blue shirt right here. Enamel, very good, awesome. Okay, who is the guy we want to go see, the doctor, we want to go see if we have a tooth that grew the wrong way? You in the green shirt. A dentist is a good answer, but not the right one. Okay, you in the pink. Yeah. Orthodontist does braces.
She's talking about one that's up
cleans
in
our
here.
teeth, pulls teeth. But who's the guy we want to go see if we have a tooth that's stuck up maybe near our nose area where the dentist can't reach? So, you in the white, oral surgeon.
Oh, she's so smart.
Okay.
Your dad's an
very
oral
smart.
surgeon?
Okay.
There's a list right there too.
Let's see. What? Okay, so there were 5 foods shown with pH numbers, right? Which pH had a 3.3? Or which food had a pH of 3.3? You in the yellow shirt? The sweet tarts, yeah, good. Awesome. Okay, so how much candy did Dr. Robison buy last year? How many pounds? Okay, you in the striped, in the back. Yeah. 2,000 pounds or 1 ton, yeah, good.
job.
Awesome, you guys are really good. Okay, so we have our front teeth, right? They bite into things. What is the word for those teeth? Okay, it is not molars, okay? You sitting down in the black shirt. the front teeth. They bite into things. There's a word for it. And that is a hint. They bite into things. Okay, you in the pink.
Does it start with a C?
Nope. Okay, you in the gray?
Buck teeth?
Buck teeth. No, it's a good answer though. You in the white? Enamel. Okay, does anybody have the answer, or you in the orange?
I think it's indentures.
You know
Oh,
what,
so
that's
close.
the closest, yeah. It's called incisors, okay?
Incisors, kind of like scissors, incisors.
What should we wear if we are playing sports and we want to protect our teeth? This is an easier one. Okay, you in the pink skirt, green top. A mouth guard, yes. Mouth guards are also good if we are grinding our teeth at night, okay? Okay, our tooth bristles, do we want those, what should, let's see. Do we want those,
3 things.
3 things that we want in a toothbrush?
A toothbrush, and we're going to tell you 2 of them.
Straight, clean, and
Straight, clean, and
you in the tie-dye blue, purple. Okay, so our toothbrush, there's 3 things that it should be. Straight, clean, and soft. Yes,
Yes.
the bristle should be soft. Good.
you guys are smart.
What's the name of the doctor that straightens teeth? If we have crooked teeth or maybe an overbite, an underbite, who should we go see? You in the purple cheetah shirt. An orthodontist, yes. Very good.
I have a question I
Okay.
want to ask them.
Go ahead.
What is Miss Cindy? What's the same about Miss Cindy and Mr. Justin Bieber?
Ah.
What are we wearing? You can call them.
Okay, so you in the orange right here?
Invisalign.
Invisalign braces, that's right, the invisible braces. Okay, I have one more and then I'm going to take some questions from you guys. How often should we floss? You in the brown shirt. Once a day. Good job. At least once a day.
knew that one.
Very good.
Good.
Okay, so who's got some questions for us?
Make sure they're questions, okay? That you're asking
Yeah.
us a question, not just a comment, okay? This one over.
You in the red.
I thought 3.3 was apples, not, I thought warheads.
It was.
Oh, it was.
I'll give you a tattoo
You were
for
really
knowing
paying
that one, okay?
attention. Good job.
Only with the permission of your parents do you get to wear the tattoo, okay?
Ah, you're right.
Yeah,
Okay.
it was,
Sorry
you're right.
about that, guys. Thank you. You in the gray shirt?
Mr. Tiki wants you to wear that with pride.
They do pull wisdom teeth, yep. And they perform surgery if your jaw doesn't fit together right. Yep.
Who asked that?
This kid in the gray here.
Okay. Mr. Tiki wants
Okay.
you to have
You in the purple
a picture
plaid?
of him. It's a tattoo. That you, gray shirt?
Okay, so if you have an overbite or you bite wrong, does that affect the cavities that you might get? You know, if your bite doesn't fit together right, I don't think so, but maybe if you had crowded teeth would definitely lead to more plaque getting stuck in certain places you can't reach, okay? You in the brown?
If you have what if you don't have floss?
If you don't have floss, you know what, we can provide that for you, okay?
It's in your bag.
And yes, it'll be in your bag today.
Is it? No, wait. I
I
didn't
don't
put
think
it
it
in.
is.
No. You can come by our office.
Yeah.
We'll give you 2 things of floss.
Yeah,
It's
stop
just
by a
down the
dentist's
street.
office or an orthodontist and they'll always provide it for you.
You do
free.
have a toothbrush and toothpaste in your bag. And one of
Okay,
these.
you?
Does a water pick count as floss?
Does a water pick count as floss? You know, most dentists and orthodontists do support the water pick. Do you guys know what a water pick is? Yeah, it's a little stick that shoots out water, and some of us don't like to floss or it's harder for us to floss, so the water pick would be the second best option, okay?
One last question.
One last question, you in the pink.
Are there certain toothbrushes that are better for your teeth than others?
Well, you know, there's many different options that we went over, and most are good for you. Just as long as you're looking for those 3 things, you know, make sure that it has soft bristles ultimately, clean bristles, and a good size handle. You'll be good.
You kids are great.
Yeah,
So you know,
thanks.
when you leave, we're giving your teacher the bags that they can hand out to you at the end of the day. And it has some things in there. And there's a game in there for you to play, the band here, and some information. Go home and ask your parents all these questions about the crocodile bird and stuff. It's really fun. But thanks for letting us come. We loved it.
Thank you.